All right, can you hear me now?
Yes.
Okay, great. Good morning, everyone. This is the Coping with the Crisis public health presentation. It's April 9th at 1 o'clock. Thank you very much for joining today. It's obviously a very timely topic, and we're here to get some information and clarification and try to get as many of your questions answered as possible. I want to thank Santa Clara County Public Health Department very much for sponsoring this webinar. And did I say who I was? I'm Marcia Huffey. I'm the chair of CADRE. CADRE, Collaborating Agencies Disaster Relief Effort. We are the local VOAD for Santa Clara County. As you're coming in, if you could please find the chat box and type in your name and the name of your organization so that we have, we know how many people registered for the call. We want to know who's really here. We save all of the chat. We will review the chat and answer questions. Good job, everybody is experts at Zoom now, I can tell. So let me go ahead and we'll ask some of the people that are coming on now to do the same thing. If you, in a few minutes, we'll have them do that as well. But you're gonna all be muted. We're recording this presentation so that those that aren't on the line today will be able to watch it later. And I'm gonna turn it over to our consultant and guru, Anna Swardensky, to lead us in this presentation.
Okay. Good afternoon, everyone. Thank you for joining us. I'm going to click forward for any of you who are still new to Zoom and the platform. There are webinar controls. As Marcia said, you have entered the room. You are on mute. And actually, we showed you this audio unmute. We have you all muted. If there's something you'd like to say, if you could use the raise your hand feature in the participants window or type into the chat box. That'll be the best way for us to handle feedback during the meeting. If you, all of you seem to be finding the chat feature to enter in your name and organization. And with that, let's move forward with our session objectives today. So for planning for a pandemic in Santa Clara County actually started back in 2008 with the H1N1 avian flu planning. I'm not sure how many of you remember that or were here in Santa Clara County with us. At that time, Santa Clara County Public Health Department made investments in preparing specifically our community-based organizations and nonprofit sector to be ready for an event that could impact our community. Not sure we were planning for the one like we're all experiencing here today, but when things first began to surface, a number of us started some discussions to see what we could do to dust off that planning and that information and bring forth some information for all of you in the sector. So today's program is a start of that effort, and we want to bring you information about pandemics, specifically about COVID-19. And as you saw in the marketing materials for today's session, we know that there are quite a number of questions in the community about COVID-19, what this means for you as nonprofits, for your clients, consumers, and many of you are providing essential services and may have some questions about the newest set of orders that were issued by our public health department last week. So we are extremely pleased to have with us today an opportunity for you to speak directly with and hear from the public health department to better understand the situation we're all facing. And so with that, we want to put at the top of our agenda Dr. George Hahn and give you all an opportunity of maximum time with Dr. Hahn to ask your questions and hear the important information he would like to share with the nonprofit sector. So with that, I'm going to move forward and introduce Dr. Hahn. And thank you so much for being with us today. For everyone's knowledge, I think we have Dr. Hahn for about an hour or so, just to a little bit before 2 o'clock. So we'll see how far we can get with Q&A, and then we have other materials to share with you. Okay, Dr. Hahn? See if we can get him to get unmuted.
Very good. Can you hear me now?
Yes.
Good afternoon, everyone. Thank you for joining, and thank you for this opportunity to share information with you. I also want to thank you for the good work that you're doing to help many individuals and families during this pandemic. I have a short presentation, and I'll go through it pretty quickly so we can get through the questions and answers. One of the things that I wanted to talk about was about maintaining social distancing, even though many of you are working in essential activities. So with that, I will go to the next slide. So this is our current look at the world, with about 1.5 million cases estimated around the world. And as you know, the United States has the largest epidemic in the world. We're probably going to hit 500,000 pretty soon here. And with a number of associated fatalities as well. We'll go to the next. And this is what our national curve looks like. As you can see, it takes off really in mid to late March, and has been sort of on an exponential curve. Next. In California, Santa Clara County was the first epicenter of COVID-19 in our state, and while we still have a large number of cases, Southern California has now surpassed Northern California as the main epicenter in California. Next. This is our public health website with a link attached. The short link, of course, is sccphd.org/coronavirus. That includes our data dashboard, and the next slide, I think, shows that. So every day, the Public Health Department updates this data. So this slide shows our total number of cases at 1,380, with 95 new cases in the previous day, with a total of 46 deaths, with 3 new deaths being reported. So this is reported on a daily basis, and you see like an age breakdown, a gender breakdown, the cases by day, and I should mention that these are the dates on these are when those cases were reported into our system. So it's not when the patients got tested, and it's not when the patient started feeling ill. It's when the reports hit our system. So there's a lot of things that impact when a reported case actually comes into us. There's also a breakdown of deaths by age and gender, and you'll see that men are twice as likely as women to die, and the age range as well, showing what we've confirmed from other countries, that older individuals are more likely to die as well from COVID-19. Though, as you can see, there are a number of folks who are under the age of 50 or 60 who have died as well. And then the next slide, I think, shows our hospital data. This is about what our hospitals are experiencing in terms of how many patients with COVID they're having in the hospital, and this is in terms of ICU beds as well. So this is the kind of data that we were looking at to see how we're doing, to make sure that we are not having hospitals that are overwhelmed with patients. Next. This shows our testing that we've done in the county. This is not testing that's done only by the public health lab, which is really more of a reference lab and can only test, around a few dozen tests per day. At the scale that testing is needed, commercial testing, commercial lab testing, academic lab testing is what's providing the vast majority of these tests at this point. So it kind of shows the total number of tests that were performed, as well as the number that were positive. I should note that this does not necessarily capture everything because all of these systems have been set up for COVID-19 only in the last 2 months, and so there's certainly lots of kinks to work out. But this is what we have at this point, and we believe this does represent the majority of tests being done in our county. Next. So let me see if I see what this slide is about. It shows the number of cases, it shows our shelter-in-place orders, and it shows what our trajectory is at this point compared to what our trajectory would have been without any shelter-in-place. So I think the point of this slide is simply to show that shelter-in-place and other orders are making a difference, or at least are projected to make a difference. And we're starting to see early signs that it is making an impact in our county and in our region. Next. And then this, of course, is the key slide about what's our hospital capacity and can we actually stay underneath our capacity. So there's two lines here. The top line is, or I'll start with the bottom line. The bottom line says this is what our normal bed capacity is, and then the top dotted line shows the bed capacity that includes the surge that we're doing in order to increase our capacity. And so it would appear that given our current trajectory with shelter in place, that we may. But again, these models are really provisional. They depend on a lot of data that's changing all the time. And this is also dependent on the community adhering to shelter-in-place orders as strictly over the next weeks and months as they are currently. Next. This is more about the website and some of the things that are featured on there, including how to make donations, what to do if you think you're sick, and information for healthcare providers. And a lot of the information for healthcare providers, though, is also useful for other partners. Next. And this was our timeline of responsive events. We started looking at COVID-19 back in mid-January. And in late January, we had activated our operations center at Public Health, the Medical Joint Operations Center. And then by March, the County Emergency Operations Center was fully activated. And then next we have, our significant events included, we started off with large events being canceled, then school closures occurred, shelter-in-place order was issued, and non-essential businesses were closed, and then we tightened those orders with the latest shelter-in-place order that came out, I think a week or two ago. Next. So these are some of the shelter-in-place changes that occurred with the second shelter-in-place order that extended us the order through May 3rd. It makes social distancing with anyone not living in your household mandatory. It makes essential businesses have a social distancing protocol. It closes down playgrounds and tennis courts and dog parks and other recreational areas. and it specifies that sports equipment such as balls can only be used by members of the same household. It prohibits most construction, and essential businesses who continue to operate also must scale down to only their essential components. And then the next slide. So we've issued a lot of guidance for healthcare facilities, skilled nursing facilities, schools, businesses. And then we've also have a healthcare surge planning task force that coordinates a field respite center, which is also known as the field medical station at the Santa Clara Convention Center, and is also managing medical supply requests. Next. We're working on housing for unhoused populations or for those who can't isolate at home. We're co-designing community strategies in response for those communities and populations who are at greatest risk. And we're doing a lot of media outreach, including regular media releases in different languages. I think most of you have seen this curve by now, the flattening the curve and what it means. One of the things it does, besides keep us within our healthcare system capacity, is that it changes, it delays when the peak occurs. So without sort of these social distancing measures, the peak occurs far quicker. When you are able to flatten the curve, the peak occurs later. And so what's happening in New York, for example, is everyone's saying that this week or next week is going to be the peak in New York. But it's not going to be the peak here in the Bay Area, even though cases began in the Bay Area far earlier than in New York. And the reason for that is because, I think the reason is at this point is that we're flattening the curve, and therefore our peak is moved later out in time. Okay, this is great. So question and answer session. So I'm going to start off with some of the questions that I've already received from all of you, go through them, and then we'll see if there are any other questions that folks have. One thing I'll mention right off the bat is that, as you know, this is a new virus, and there's so much that we still don't know, and we frankly don't have all the information that we need. We need more information than what is currently available in terms of how the virus is transmitted, how it behaves, and what are the best ways to keep us all safe. And because we don't have all the information we need, and because we necessarily live in a limited, finite world, we're forced to make decisions that balance competing priorities. And so there's like the ideal, and then there's the reality, and that's kind of what we're doing every single day is how do you strike the right balance of when to which way to go, what decision to make in the absence of clear evidence or data. And that's something that we do every day, and that's something that probably most people who are living in this pandemic are having to grapple with. So I wanted to make sure I put that out there straight off the bat because, I'm not the one who knows all the answers. No one, frankly, has all the answers, and public health does not have all the answers, or the CDC. But we're, trying to do the best with the knowledge that we do have, and we are learning more every day, every week. And so this is an evolving, dynamic situation where what you hear today may end up, some of it may end up changing in a few days, weeks, or months' time. One of the things that I recommend currently is that that many of you do essential work or are in organizations that are doing essential work. But even though you're still doing that work, you should still maintain as much social distancing as possible in those environments. And so it's not like you're doing essential work and therefore the virus doesn't affect you, right? We think actually that the places that are still open, like for example grocery stores, are now kind of the places where people are getting infected because those are the only places that people are able to go to. And so it's really important that essential businesses and workplaces really take the right precautions to decrease the risk as much as possible. What this includes is treating everyone, including yourself, as if you are infected and contagious. So the reason we now say that is because we now know that there's asymptomatic transmission, meaning you don't have to be showing symptoms and you could be infected and you could be contagious. The thing we're most worried about is in the 2 days before you start showing symptoms, we think that's when people may start becoming contagious. And so, you could start coming down with a cough or start having a headache or feeling tired, but that means that, and if you end up having the virus, right? And then that means that 2 days before you started feeling those symptoms, you might have already started becoming contagious. And because the virus is so widespread in our community, in our county, in this country, it's safer to just assume that everyone is potentially infected and contagious. And that is why we have now recommended, I think as of last week, that everyone wear a face covering whenever they're interacting with other people. And what that face covering does is two things. One is it prevents you from exhaling the virus onto someone else. So what we say is, my mask protects you, your mask protects me. And it does provide a small amount of protection for the person who's wearing the mask, because let's say someone coughs and there's like droplets in the air, and that those droplets might land on your mask instead of directly on your nose or on your mouth. So there is a little bit of protection, but primarily the reason that recommendation came out was to protect others. And the other thing we say is don't touch your face and wash your hands frequently. And kind of clean, frequently touched surfaces. And all of those things are guidelines or our recommendations, because they're based on the assumption that you yourself are infected and contagious, and they're based on the assumption that everyone you come into contact with is infectious. And so that's why it's important to work together with are the people who are in your household. Your household unit should be the only people you are allowed to come into close contact with and touch. And so everyone else outside of that household unit cannot, don't come into close contact. Make sure everyone's wearing a mask. Be very careful. So with that out of the way, I'm going to try to talk about some of the questions that came in. One was about the number of cases by city, and I think that is going to be coming soon. One is about what will return to normal activities look like. Okay, this is still being, I think, worked out. I don't think anyone really has a clear idea yet of what return to normal will be. My personal opinion, which is not the opinion of the Public Health Department, my personal opinion is that we won't be going back to normal until there's a vaccine, and that won't be until next year. So in the meantime, there's going to be some return to normal activities, but it's not going to go back completely to normal. We're definitely actively working on what it might look like, what that some return to normal activity might look like in the meantime. How can we make sure that everyone, including ethnic minorities, get the same information? And yes, that's definitely one of the things that we're really focused on, is making sure we have materials that are translated, as well as partners within the communities to get the information out there. There's a question about comparison of flu versus COVID, and it does appear that COVID is more deadly than flu at this point. And yeah, it's one of the main problems with COVID is that no one has immunity to it. And so with flu, a decent proportion or percentage of the population has at least partial immunity to flu, whether it comes from having had the flu in the past or because they've gotten a flu shot. And so with COVID, there's none of that. There's zero immunity amongst the entire population, and so it has the potential to spread far more widely than the flu. and it does appear that it could be deadlier than the flu. We've covered the face coverings, and I should mention one other thing with the face coverings. They are, at this point, we recommend that face coverings not be medical masks like surgical masks or N95s, and the reason for that is because, as you all know, there's a huge national global shortage of medical grade masks, and so we're trying to reserve those as much as possible for first responders, for healthcare workers. And we're saying that everyone else should wear the cloth face coverings, bandanas if you don't have any, or that kind of thing. And that is something that should occur at all times when in public or in contact with people outside of your household, basically. How long does the virus stay in the air and on surfaces? That has been a question that has been really challenging to answer, and we're getting new information about that all the time. So, initially we believed that the virus was primarily spread through respiratory droplets, like the kind of, like if someone coughs, for example, you sometimes can see those tiny little droplets that come out of people's mouths when they cough. So originally we thought that was the primary method of transmission. We still think that is the primary method of transmission, but we know that other ways to get it might be aerosolization. So a person can generate aerosols, and they go into these tiny, tiny little droplets that float in the air. We don't know how long they float in the air for. It could be minutes, it could be an hour. And so that is under active research. And we also don't know how big of a component, how significant that is. Does it only affect a few people, or is this like a really big deal that a lot of people are affected this way? So that's currently unknown, but I think it is important to note that that is a possible way of transmission, is through these tiny aerosols that could hang out in the air for an hour. And then there's surfaces, and so let's say that someone coughs and like the virus lands on a doorknob or something, or someone is ill and they've like rubbed their eye, right? And then they get the virus on their finger, and then their finger then goes and touches a surface like a doorknob, and then you go touch that doorknob with your finger, and then you take your finger and rub your own eye. So that's another way for the virus to transmit. We don't know exactly how long it lives on surfaces. It's probably hours to days. But the good thing about this virus is that like regular cleaners can clean it, and soap and water, of course, can clean it from your hands, as well as hand sanitizer that has an alcohol content of at least 60%. Let me see if there are any other. So there's a question, I think, about what to do if someone's exposed. This goes a little bit back to what I was saying about how you should think about everyone always being constantly, like we're all constantly exposed. So we need to all constantly be mindful of what we do with our hands, covering our faces, not touching our faces, and then monitoring ourselves for symptoms. We want to keep monitoring ourselves if we get fever or cough, shortness of breath. Those are the main ones. But other symptoms include, fatigue and body aches and headache and vomiting and diarrhea and loss of sense of taste or sense of smell. Trying to think what else, confusion, altered mental status. So there's a number of symptoms that could indicate the beginning of illness with COVID-19. And so if you do feel those symptoms, actually you can go to our website and tell you exactly what you should do, because it's too long for me to explain all the things that you need to do. But the most important thing to do is make sure you're at home in your own bedroom isolating, just in case you do have COVID-19. And then, call your healthcare provider. So let me see what other questions
There's questions
here.
that were coming in via the chat, and I can help you with that. We had
one.
one.
If you could do that, that'd be great.
Sure. So how about someone's asking, what's the latest on serology and its reliability for determining immunity as well as the availability of that kind of testing?
That is an active area of research, and unfortunately, I don't have an answer. I know that in other viruses, we tend to think that detection of antibody through, a serology test indicates immunity. We think that probably is the same for this virus, but we don't actually know how long, what percentage of people with antibodies are immune, and we don't know how long that immunity lasts. We also, there's also the possibility of, false positive, false negative tests, and cross-reactivity with other viruses, other coronaviruses. So it's unclear to me. As far as I know, from a few days ago, there has not been an FDA-approved test for serology, but that could have changed today, and I wouldn't have known.
Here. And a little bit along that same thread, there have been some information or media reports on the concept of herd immunity. Is this hit our county? Can you talk a little bit about this data or information about herd immunity and if this actually did impact Santa Clara County earlier than was expected?
Yeah, I don't. My personal opinion, again, this is an opinion, is that that's not what happened in California. I think the reason California is seeing fewer cases is not due to herd immunity, but due to our earlier orders and shelter in place, and our populations taking those messages seriously earlier than other locations. We here in the Bay Area particularly know that we have lots of travel from mainland China and other parts of Asia. And so I think we were way ahead in terms of understanding what the threat was than in other regions of the country. That's my personal opinion.
Marcia and I together are kind of sharing the chat box, and folks, please keep writing in, and we're going to keep monitoring.
Yeah. So one is, do you have up-to-date information on the number of people that are still unsheltered that you wanted to be sheltered?
Do we have people who are unsheltered who we want to be sheltered? That I don't know the answer to that question. We do have a housing unit that's led by Ki Lee, who's our director of supportive housing. So I don't know if where they are in the process of housing folks.
Okay. How about, are you tracking data by race in Santa Clara County?
That is something that we're trying to do. Part of the problem is when we get these reports, they don't come with necessarily race and ethnicity data. And we recognize that that's a huge gap. And so we're trying to find ways to get that data in a more comprehensive manner than we're currently getting. Laboratories are the ones who report cases to us, and then they being tested, and so then we have to track down the doctor or the patient themselves to try to get that information, and that's quite labor intensive. So we're trying to get more of that. We do have some partial data though on that we're trying to look at.
Okay.
Another one that came in was from, it said, poverty is the common denominator for negative health outcomes, child abuse, violence, etc. How is the financial impact of shelter in place being weighed with public health concerns with the virus?
That I can't speak to because I'm not involved in those decisions, but certainly that has been something that is weighed very, very seriously by our health officer and by the management team here at the county. And I presume across the country that this is something that weighs heavily on our leaders.
Okay, how about any recommendations for the older and mentally or cognitively impaired who normally successfully live independently, but now because of the shelter in place, they can't?
I think that's something that we're trying to look at as well, and would welcome partnerships with folks who can help think through these issues. We know that there we know that there are certain vulnerable groups already, right? Whether they're older adults or people with comorbidities. But then as we start diving more and more into other possibly vulnerable folks in our community, one of the groups that keeps coming up is people with behavioral mental health issues, and that is a huge ongoing challenge. I'll just acknowledge that.
Okay, how about any statistics on healthcare professionals in the county that have contracted COVID-19?
No, and the reason for that, and let me just mention how we kind of got to where we are. So initially, when we first started getting cases, we were able to interview either the case themselves or the patient themselves or their doctor and find out all this kind of information about who they were and that kind of thing. And then as our case numbers started taking off, we couldn't do that anymore because there were just too many people, too many patients that were coming into being reported to us every single day. And so we've actually lost the ability to kind of find out on an individual level who exactly is a healthcare worker, for example. One of the things that we've done is we've partnered with the hospitals so that whenever they have a healthcare worker who has COVID-19, that hospital is responsible for ensuring that the healthcare worker isolates at home and that they take care of any kind of notification of their coworkers or patients who might have been exposed to that healthcare worker. And so we've lost the ability to know which healthcare workers in our county have COVID-19. Now, as shelter in place works, what we hope is that it will bring down the number of cases of COVID-19 lower, so that we will be at a rate where we can start to pick up some of these things, some of these investigations again. And so once we get to that state, we hope to do a little bit, know more detail about each case that we're getting.
Okay, I see a question here. If you're including home deaths in the death statistics, home deaths from COVID-19?
Correct. Yes, we are.
Okay.
And do you have any information regarding increase of testing, particularly for residential facilities such as long-term care facilities and crisis residential facilities?
Let me see, particularly for residential facilities. Yes, so for long-term care facilities, we are, so particularly in the ones who are experiencing outbreaks. There are a couple of them that are experiencing outbreaks currently, and so we have focused a lot of resources to make sure that they all get tested. Now, we are working on increasing testing for other facilities. That is something that we'll have to think through. So we have an overall kind of idea of like we need to ramp up testing and how do we get more testing. I think all of that is dependent on supply. As you know, there's a severe shortage of not only test kits, testing ability, but also materials that are required to either collect the specimen or materials that are required to do the pre-work that's done in the laboratory before it can actually be tested. And so the supplies that are missing are things like Dacron swabs and extraction kits and viral transport media, in addition to test kits and machines and personnel and all of that. So there's a whole host of materials and staffing that are in short supply. And so what I've said in other calls that I've led is really asking everyone to use their organization to write or call or contact the governor, the president, and the vice president to please use the federal government to ramp up testing supplies in this whole country. They need to manufacture a lot more of this stuff, and it needs to be done at a federal level because that's the only level in which we can coordinate and distribute the sheer number of materials that are needed for testing. I know that, and we all know that testing is still a huge problem. That problem has not gone away. We are still unable to test the people that we want to test. I want to test as many people in facilities as I possibly can. You know, if I had the choice, I would test anyone in those facilities who had even a hint of a symptom. I would test every single new resident that came into that facility. You know, so I can't do that though without the testing materials and supplies. And so we're really hamstrung here with what we can do because of the national landscape for testing. And I think that, you know, that's why it requires advocacy on as many people as you can get together to write to our elected officials to make this change. And I might add that this is not just reflective. This is just not just a problem with testing. It's a problem with supplies like N95 masks and surgical masks and gowns and gloves and ventilators. I mean, the list just goes on. That federal leadership is really needed.
And on that note, there was someone wrote in a question, because we know that there is an issue with supplies, N95 reuse. Do you have any recommendations for cleaning and or how many times can they be reused?
So what I do is I just follow what's on the CDC website, and there's definitely a page on that, and so I would definitely recommend that you look at that. The general guidance is that you use it until it's soiled, and that's kind of the basic thing. And I haven't looked, you know, I'm not in wearing N95s every day, so I actually don't know what the specific procedures are.
All right, how about any guidance for pregnant women to know the protocols for each hospital? Is there any general guidance for Bay Area hospitals?
Pregnant women is actually an area where we know very little, unfortunately. So we're not even sure they're a high-risk group. I think a lot of folks have put pregnant women on the list just because we don't know. And so I don't know what to say except that pregnant women should take every precaution to not get infected, and that they should, you know, be in communication with their providers.
Someone's asking, do you have any idea which restrictions might be lifted first at the point at which things start to ease up, and what kind of?
I wish I had that crystal ball, but I do not.
Okay. Any recommendations for our nonprofits on things they should be thinking about or planning towards as we look ahead?
What I would plan for is kind of a new normal. Honestly, that's the best advice that I can give you. Do not expect that things are going to be lifted on May 3rd. I think that's the best piece of advice I can give you, is to expect that some kind of restriction, perhaps even the same restriction or perhaps even more restriction, will continue beyond May 3rd. And as I mentioned earlier, I don't think things will even have the possibility of returning anywhere near normal until the vaccine comes.
And do you recommend virtual mental health and grief support?
Absolutely. I think everything as much as possible should go virtual. And I think we should make whatever investments that are necessary to make that now, if it hasn't already been done. You know, in terms of in-person contact, I think that can be done in a way that reduces the risk. It's not going to reduce it to zero, but it will reduce it significantly, you know, if both the client and the practitioner wear masks and are very careful about not touching their faces and washing their hands and all of that stuff. I think it is possible to do in-person visits as well that are pretty safe.
Okay. I'm not sure I understand this question, but it was submitted. How should essential organizations deal with third-party potential exposure?
Oh, so I think that has to do with, I think I was in the middle of explaining it and didn't get to the end of it. So let's say that you find out that someone has COVID and they were, let's say in your food pantry. Let's say they were a volunteer in your food pantry or your food bank. So what you would do, and this is, by the way, detailed on our website, what you should do, you would see if they came to work sick, and if so, that means anyone who was in close contact with that person might have been exposed to the virus, and then that they should monitor themselves for 14 days after that exposure for any symptoms, right? Now, some people may want to quarantine themselves, self-quarantine for 14 days during that period, depending on how close their exposure was. So let's say the person who was sick was their best friend at work and had lunch with them and, like, was totally within 6 feet for, more than an hour. That, that person may want to consider staying at home and monitor themselves for symptoms for the next 14 days. But people who had less exposure may want to just keep going to work, but then monitor themselves for symptoms and make sure they're always wearing a face covering. But everyone should be wearing a face covering at this point, right? And so what I just described to you, it almost isn't needed anymore, because now everyone's wearing a face covering, everyone's washing their hands, we're all not touching our faces, we're all making sure that as soon as we get the symptoms, we're going home and isolating ourselves, right? The reason for those guidelines is based on the assumption that we're all infected.
Okay. And so with that, there was a question also of, if someone is recovered from COVID, can we get it again?
That's a really good question. We don't know. The short answer is we don't know. We believe that you're immune after you have recovered from the virus, but there's active research being done on that. I don't know if it's 100% of people are immune, or if it's 90% of people are immune, and I don't know how long that immunity would last.
Marcia, do you have any?
I think I've answered them all.
I know, Dr. Hahn, you addressed the issue of the supplies within, kind of the testing environment, but we did see a question of, do you think that in the future there will need to be widespread testing? Or, kind of, what do you think about this whole testing issue? And there was some question about federal government reducing support, stopping support for COVID testing.
Yeah, I think I heard something about that too, but what I know at this point is that we need more testing, and that need is not going to go away anytime soon. And I think there are various ideas and not just ideas, projects out there that are going about testing in different ways, right? So the first way of testing, the original way of testing, was to use a nasopharyngeal swab and to stick it in your nose and all the way to the back of your throat, and then put that in viral transport media, take it to a lab, and then run a PCR test on it. That was the original way. So now there's all these other ways that are coming up. Some of them are FDA approved, some of them aren't, and it's really, unfortunately, quite a difficult environment to get a handle on what's going on, because there's so much news and so many different tests that are coming out, and we're trying to figure out, well, which one of these tests are reliable, which one of them actually work, what do they measure, because different tests measure different things, right? So the nasopharyngeal swab measures the virus genetic material. That's what it detects. Whereas the blood test, which is the serology test, measures antibodies that your body produces against the virus. And so the tests tell us a little bit different things, and they measure different things. So it's hard to say how this is all going to end up shaking out. I think if certain tests are, come into the mainstream, then our strategy may evolve depending on what tests are available, what good tests are available for us. But again, like I said, I think at this point, the one thing I know for sure is we need a lot more testing.
And any antibody testing in the works?
Right. Yeah, that's one of the things
Okay.
that's in the works, and I don't have a good handle on that yet.
And there was a question now, some folks do want to write to the people that you suggested. Is there something that could be written up as a template letter that we could share?
I probably am not the right person to do that. And we do have, so I think the county is thinking about doing that from the county kind of officially, but if folks in CADRE are interested in doing that, I think that would have to come from you.
I did have a specific question that was entered in during registration. It was, is it acceptable to have two people in a room sleeping with their heads at opposite ends of the bed?
So I think this question goes back to the statement I made initially, which is the difference between like the struggle between ideal and reality. Obviously, the ideal is every person gets their own room with their own bathroom and can shut the door. You know, that is for people who are sick, right? And then we know that if people, people who have confirmed, are confirmed to have COVID-19 with a lab test, we know that two people who are confirmed to have COVID can stay in the same room together. They can be cohorted together because they both already have it, right? So that makes sense. Now, for people who don't have any symptoms, yeah, I mean, the ideal is that everyone would get their own room, but like the non-ideal is we know that that's simply not possible in many circumstances, and so you make do with what you have, and you monitor for symptoms, for example. That's one way you could think of how to handle that situation. So I don't know what the specific specific situation is, like if those are people who have symptoms or are totally symptom free, or are they kind of mental health patients, or what the what the situation is.
Okay. Are we seeing any other questions in our chat box from our participants? We still have over 100 people on the line with us that were very interested, Dr. Hahn, in hearing your presentation and having an opportunity to ask you questions. Marcia, did I skip over anything?
I'm just looking back through them again. I think we got them all.
And I'm going to pose one question to you, Dr. Hahn, that I'm not sure it's for you, but it was entered. Are there any FEMA deadlines that nonprofits should be aware of from a health officer's perspective?
Yeah, I am not sure about that. Sorry.
Yeah.
Oh, there's one more, Dr. Hahn. I don't know if you'll be, oh, okay, a couple more. That's good. So we do have an Immigrant Relations Committee, and they are in touch with many portions of the community that speak other languages besides the top 4. There are people that are willing to do translations. Is there some way that we can work with you to spread the communication in other languages?
Probably. We'll make a note of that.
Okay. And then let's see, did I see another one? And you did say that you're not sure if people get COVID and recover that they can get it again or not.
Correct.
Right.
Most likely they can't, but like we don't know for sure.
Okay. And then what's the most, what do you want us to tell the public? How can we help you get the message out? What's the most reassuring thing we can say?
Let me think about this one for a second. I think the most important message is to speak to the social distancing measures that we're all taking. I think that if you can get the word out that that is necessary, that we think it's working, I think that would be really, really excellent. And if you can help make sure that everyone knows that they should be wearing face coverings whenever they go out of the house, and that to try to limit their trips outside of the house. You know, some people are so cooped up that they go to the grocery store every day, and that is really counterproductive to the intent of the order. You know, every time you go to the grocery store, you should stock up so that you can not go to the grocery store for like 1 or 2 or 3 weeks. You know, that's the whole point, is you don't want to go to the grocery store. You don't want to go anywhere in public if you can help it. So I think that's a critical message.
Okay.
I saw a message about, do husband and wives with no symptoms still sleep in the same bed? So that goes back to the earlier thing that I said, is you have to establish who's in the household, and whoever's in the household, that's who you're with. You know, and like you're constantly exposed to everyone in your household, and that's okay because that's your household unit. Does that make sense?
I see another question here. Can we expect a resurgence in the fall?
Yeah, I don't know the answer to that. Folks are saying that maybe it'll, you know, start to go away in the summer and start to come back in the fall, but honestly, we have no evidence of any of that.
Okay, and any existing drugs that might help to treat or prevent?
That's a really good question. I think that's one that deserves asking, you know, on a regular basis. So there are no FDA-approved drugs to either prevent or treat COVID-19 at the moment. There are a lot of drugs being tried out and experimented with. But do any of them really work? We don't know. At least we don't know officially.
Okay. Oh, here's one. Staff that are still going into the office because they're essential, if they're practicing social distancing, do they still need to wear a mask?
Yes.
Yes.
Absolutely. You should wear a mask at all times.
Okay.
The reason I'm not wearing a mask right now is because I'm in my own cube away from everyone else right now. Otherwise, I'm like I'm wearing this thing. I've got it right here with me.
And we see Molly on our screen too with her mask still on. Dr. Hahn, we've had some comments, I'm not sure if you're seeing them, thanking you for being so down to earth and transparent, for everything that you've brought to today's conversation. It's helped to reduce stress amongst our participants on today's call. So we really do thank you for your time and for your investments and your department's investments in our nonprofit and community-based sector. This has been a great experience to, you know, kind of hear from you directly, and you know, you're getting a lot of thank yous coming in through our chat box. We do have another, you know, slide that I think we put out there for the group of ways to help folks stay informed with some of the links. And Marcia, any other comments?
No, it was great information, and I love all of these questions that are being asked. People are really thinking about this in a good way. There was one other about hand washing. Can public health support a hand washing campaign?
Well, I think we've been doing that from the beginning.
Yeah.
Yeah.
I also wanted to add, you know, this weekend is Easter, and we definitely want to make sure all of you can get the word out to please do not gather for Easter. That is one of our really big worries, is that some people may do so, and that will create an outbreak. So we really want to try to avoid that. Please get the word out to not gather for Good Friday or Easter or anything like that. I know that a lot of churches are being creative and doing things virtually online or through even just telephone calls, and so please encourage that to happen instead. Yeah, Passover this entire week, I just saw that. So that needs to get out there.
There was one other question that came in on the side here. Animals and COVID. Any spread via pets, household pets, animals to human,
That's
human to
a
animals?
really interesting question. So, I you know, I used to think that I knew a lot of answers, and the more I go along with this, the more I realize that we don't know the answers to so many things. So let me say, so yeah, I mean, there's that tiger who got it. So does that mean that cats could get it? I have no idea. What I can say is that you do not want other people petting your animals, because the virus could then transmit to their fur, and then once you touch their fur, it's on your hands, and then it's all over, right? So I know that for sure. And that's also one of the reasons dog parks were closed in the new order, right? Because that was definitely, I bet there's transmission occurring at dog parks.
Mhm.
Okay.
All right.
I do want to thank everyone for their partnership, because I know that you're doing great work with the community, and we're so glad to be able to partner with you to make sure you and everyone you work with and everyone you serve have all the latest up-to-date information to help protect us all.
Yes.
And then we have a little bit more after. Thank you again, Dr. Hahn. We have a little bit more to the presentation. And if you can hang out to the end, I guarantee you won't be sorry, because we've got Janet Childs from the Bill Wilson Center is going to give us a little bit of self-care, which we probably all need right now or know someone who does. So if you can hang on, that would be great. All right, Anna. Thank
Okay.
you again, Dr. Hahn.
Thank you.
Thanks, Dr. Hahn. Okay, so as I said before at the start of the presentation, planning for pandemics in Santa Clara County actually started back in 2008. And there was a huge effort at that time that involved many within our community, with our government jurisdictions and our nonprofits and our faith communities. And there was actually some pretty extensive planning and workshops and exercises. And one of the things we wanted to bring to you all today as part of the start of this program was to talk a little bit more about what are some of the things that we know from some of our planning efforts that were focused specifically on community-based organizations. And so what you see on your screen is actually a toolkit that was prepared by our health department, specifically for our community-based organizations. And we hope later, when things calm down a little bit more, that we can bring out to you some of the information, the planning guidance and such that was developed as a part of this toolkit, updated for COVID-19. But one of the things when we originally concepted today's program was, we think, this happened quickly for us all in Santa Clara County. And while there's been a lot of media coverage, we wanted to kind of, for starters, start with, some baseline understandings of, what is a pandemic, and, what are some of the terms and clarifications. So, it is a novel strain of a virus, as Dr. Hahn talked about. It has a high human-to-human transmission, and generally means global spread. So we've had any number of pandemics in the 21st century, probably the most significant of which was the Spanish flu back in the early 1900s. But we've had other ones and we wanted folks to know that pandemics actually occur naturally. There have been 10 documented flu-like pandemics in the past 3 in just the last century, 2 that occurred later in the 1950s and 60s, that some of us, that were much milder than the Spanish pandemic, but still quite important. So why is there concern about pandemics? And bottom line is, we can't prevent or stop pandemics from occurring. And so while In 2008, we were originally concerned about the H1N1 avian bird flu and how that might mutate into a new or novel strain. We knew then that a pandemic could happen with little or no warning, and COVID-19 has certainly become the most extensive worldwide pandemic, I think, of our lifetimes. So it's not a typical health emergency. As we talk in CADRE about emergency and disaster planning, in terms of what we call a multi-hazard approach. Most of us think of that meaning earthquake, fires, floods, chemical releases, and things that are rather localized in a geographic region and limited by time, meaning it has a relatively short duration. Pandemics, by definition, are worldwide, and research tells us that they can last for several years. One of the things that we want to kind of, you were starting to hear this a bit in the media, but we want to drive home the point with our nonprofit sector and our community-based organizations that we do need to be thinking about how a pandemic can come in waves that often last historically from 10 to 12 weeks. They can subside and then reappear. And we're starting to hear some of that, even though we're not even yet at the peak of our current experience. It happens, with a very rapid spread of the disease worldwide. We're seeing there's some fairly significant economic and social consequences. And, bottom line, unlike other disasters where we can lean on other parts of our state or and our country for help, everyone's experiencing this kind of at the same time. And we're seeing that play out daily and how our resources are stretched. And every community is focused on who's sick, who may become sick, and or we're taking care of our own friends or family who are sick. So we know this is, quite significant. It has pretty significant impacts to our healthcare that we're seeing all across our media these days in terms of the staffing and bed shortages, the supply shortages, the number of folks that are being cared for by their own family members at home. And probably not a really wonderful statistics, but something to share from our past planning and understandings is that pandemics come in waves, they come and go. This was definitely the case for the Spanish flu in 1918. That pandemic lasted for 1.5 to 2 years. The demand for care will outpace our supply. That's why we're seeing so much planning going on for what Dr. Hahn talked about in terms of surge capacity. We're all anxiously, I think, awaiting, the concept of a vaccine coming forward, but oftentimes it could take anywhere from 12 to 18 months. And we know from what we're seeing in our general media how this is a worldwide effort at this point to come up with both treatments, preventative measures, and ideally a vaccine as quickly as possible. So, at this point in time, no treatment available, lots of services overwhelmed in many different places. So what does that mean to you all as community and community-based organizations, nonprofits, serving, driving home kind of Dr. Hahn's closing messages of actions that you can take. Ensure that your organization is following the health officer's orders to stay at home, shelter in place, the recommendations on social distancing, hand washing etiquette, face coverings. We wanted to make sure we gave you an opportunity to find the links and the appropriate sources of information that our public health department wants to drive home for our sector. For those of you who haven't yet seen, there was some recent media coverage about the impact of our stay-at-home orders and the glimmers of hope that we're seeing on your screen. Dr. Cody did some interviews just this past weekend on Sunday and Monday. Grab those links, Google them. There's some in short video clips that hopefully will give us some glimmer of hopes of what's to come. We have in this slide deck, as we had mentioned at the start, we'll be making the recording of today's session available. We can also put up the PowerPoint so you can grab this information. Molly Carbajal is online with us as well from the Public Health Preparedness Division. She gave us a whole file of information and resources targeted for the nonprofit sector that we will be putting up on our website, both on the CADRE website and on the Silicon Valley Council of Nonprofits website. So all the good information that we have about hygiene, cough etiquette, home isolation for folks who are ill, home care plans, things like that. We're going to give you as much information from the Public Health Department to share with you all for the care of your own families and loved ones, as well as the clients and consumers that you are seeing regularly. I think the last slide I want to share with you before we give the program over to our lovely Janet Childs is, what does this mean for our network of community-based and nonprofit organizations? It's certainly important that we want to coordinating with others. This is a shared responsibility for us to plan together, to be as educated as we can be, to communicate and coordinate with one another. This little graphic is, intersecting circles of all kinds of folks that need to come together for this type of an event. CADRE and the Council of Nonprofits hosts Monday morning interagency coordination calls at 10 a.m. I think a lot of you who dialed in today's session are part of that. If you are not, and you want to join us every Monday morning from 10 to 11:30, we run a large Zoom call with updates from our government partners at the county, the state, and federal level, and then we hear from our community members, from you all, what's happening out there, what are the various ways that we are supporting the needs that we're seeing from COVID-19, what are the resources, how do we support our neighbors, friends, family, and community members. So join us for those. If you are not already a part of that, you can reach out to us at CADRE and we'll get you connected to that. At this point, I am going to turn the program over because we did call this Coping with the Crisis. And we want to, let's see, I see Janet picking up her telephone. I see her on the video, but Janet Child, one of our founding CADRE members from back in the pre-Loma Prieta 1989 days. She's been with us ever since. She's an incredible resource to many of us throughout the greater Bay Area. She's been actively providing crisis intervention counseling and education, focusing on loss, illness, crisis, stress, grief, a number of feelings and emotions a lot of us are having over the last 6-8+ weeks. So Janet, let me turn this program over to you. We need to unmute your microphone, and there you are.
There I am. Can you hear me?
Yep.
Awesome. Well, it's just such an honor to be here with each and every one of you. And I just can't thank you enough from the bottom of my heart for whatever you are doing in the community. I've actually lit a candle for each of you. And of course, it's in our CADRE blue. Just to remind you that you are the light that is needed. You are the hope that is needed. And that in order for you to give what you give to the community, we have to take care of you and make sure that you get taken care of. And so know that that light is lit for you and that you are providing something that is so powerful and that is so needed. And I don't know how I flipped my slides. There we go. So basically, we're talking about trauma and stress in general, but what it means for us in this pandemic is that we are dealing with our entire lifetime. Every aspect of our life has been impacted and changed and adjusted. And we're not only having to adjust it, one time, every day new information comes and we're having to adjust it again. And so this is going to bring up all kinds of stress. It's also going to bring up what's in our backpack, what we call, our cumulative stress. For any of us that have survived other critical incidents, there's been an end to it. But this, we don't know when the ending will be. And we're hearing different predictions about what that might look like. And for each of you, acknowledging that in addition to dealing with your own acute and delayed stress, you're also dealing with everybody else. So just remembering that a broken arm is like a broken heart, is like a broken arm. And what we mean by that is emotional trauma is treated by the body exactly the same as a physical injury. So be gentle with yourself. Realize that we have sustained a huge injury in having to live through and survive this trauma. Know that you have the right, in a real way, to take care of yourself. And it's going to be difficult because our guilt and our responsibility feeling that we might have for our community may stop us from doing some very basic things of self-care that we can do. And one of the first things we can do is acknowledge. And I don't know how to flip this. Can you flip it for me?
Yeah.
I don't know why it's not flipping. Just to realize that we're going to all be impacted by this. And if we are caregivers, we're even going to be impacted it in a more delayed way. So you may think, I'm doing pretty good. I'm hanging in there, taking care of the home family, taking care of the work family. And meanwhile, what happens is that you hit the crash wall. And sometimes it can be a little thing that hits the crash wall, because this is both invisible and interminable. And what I mean by that is we don't know the ending of it, and we're dealing with an invisible foe. We're dealing with a person, we can't see it, and it doesn't have an end. And so this is grief in its deepest way. This is grieving over our entire life as it once was, and grieving for the future, for what could be. So I think when we acknowledge the grief, we give space to just say, oh, okay, this is the way it is, and I'm just going to acknowledge it and be gentle with myself. And to know that it's never too late to respond. It's never too late to take care of yourself or take care of another person by being that presence, by being that caring, that healing, that spiritual, wonderful person. And how can we do that? Just very simply, the same gift we would give to others, we give to ourselves. And this means, giving of our presence in any way that we can do that, through video, through audio, through writing. I know many people are now going back to sending snail mail letters as well as emails. Okay, so this is powerful. When we can give each other space, sometimes when we're confined in a small space together, just being able to give each other space when we can, listening and honoring, asking, what is it that we need right now? What's impacting us the most right now? The two things that make stress and trauma worse are feeling out of control and feeling isolated. And this has definitely done that for us. So if we can do anything to put ourselves back into control, even in small ways, and getting back into community, back into team, that is a huge gift that we can give to ourselves and to each other. Giving choice wherever we can. Being honest. We don't have it all together. We don't have all the answers. Being honest that we're in this together, which, by the way, was the old byline for, CADRE, together we do better. And it's absolutely true. I mean, I just love CADRE because CADRE has stepped up in a beautiful way in the midst of this pandemic, providing resources, providing ways of connection. It's powerful. So take advantage of that. And then validating yourself. That's all we have to do, my friends, in terms of stress management, is get ourselves from out of control to in control, out of isolation and into community. And so this is our triangle of response, our triangle of support. We ask, we listen, and we validate. For emotions, we sometimes can't fix it. We can't make it better. We can't make it go away. But just by asking, how's it going today? What's hit you the hardest? Listening to the details of the stress allows us to get it from the inside to the outside. And then finally, validating what you're experiencing is a natural reaction, and validating this sucks, what we have to go through. You know, validating that it's hard. That's a huge gift that we can give to ourselves and to each other, is that very simple thing. Ask, what's hitting you the hardest? Listen, let the details come out, because that literally de-entrains them from the neural pathways of our brain and allows us to have that moment of release where we're a little bit lighter, and then validate. And this is the triage that we want you to remember. First of all, breathe. And I just invite us all to take a nice deep breath. You know, you've probably been on video conferencing a lot of the time, and you've probably, you know, been working hard to do different ways of interacting with the people that you serve. Let us breathe. Drink plenty of water. Believe it or not, my friends, the COVID virus does not like water. And especially if we keep our mouths moist and with a little bit of warm water, we're creating a little protection for ourselves. Move. Eat. And what I'm doing is eating a little bit every moment. Like if I can, every couple of hours, I'm eating something, rather than waiting till the end of our day where we then eat a ton of chocolate, which is what I've done a couple of days, where I'm just going, holy moly, why did I do that? Now I can't sleep at night. Give yourself a break and identify what you can do, a little action step that will make it a little bit easier for this moment right now. And what's so important is we've got the words down there, right now. It may change moment to moment. What we may need right now may not be what we need 2 hours from now. So by doing those regular check-ins with ourselves, and also doing that for and with each other, we create a matrix of support. We create a matrix of healing where we know we can come to that place and get the safety of being able to tell what's really on my mind and in my heart and living in my life right now. So the last thing I would like to leave you with is that in a powerful way, you remember that you are making a difference just by your presence. There are many things that we can't fix, that we can't control, but what you can control is how you respond to it. And we've come up with 4 steps. Acknowledge it, express it, do an action step. If it's as simple as having a thought, you know, lighting a candle, you know, going outside, taking a breath of fresh air, whatever it is that reconfigures and gives meaning to what you're going through. And then the last step is to reconnect. And that means reconnecting with what is still good. I call it being grateful. At the end of the day, I help myself to identify what's one thing that I'm grateful for today. What happened today that has made me feel like, you know what? It's been a good day. We've made connections. We've made a difference. CADRE is a wonderful part of my gratitude basket. CADRE has a big role in my gratitude basket because we are doing so much and we are with each other in such a powerful way that we're going to build that matrix of support for our entire community. Savor what's good in your life, and I would leave you with this. Know what you are doing is powerful and needed, and that only you can bring your unique brand of that hope and healing. And do something fun and decadent and life-affirming for yourself before the day closes today, just to give yourself a treat. And thank you from the bottom of my heart.
Thank you, Janet.
Thank you.
Thank you.
And thank you to everyone who in today. We really do know so many of you are doing such incredible work. We know we still have a long way to go in this event. And I'm going to give it back to Marcia to give you some closing comments and a couple of questions.
Yeah, thanks. Thank you, Janet. Thank you, Anna. This was a nice break. I feel like I just had a nice tall drink of water. So thank you. Yeah, so we will be posting this information. Find my notes now. I've gotten completely distracted. Yeah, we're going to do another presentation in a couple of weeks on the 24th. And so stay tuned for an invitation to that one as well. We'll post the CADRE website for you. Anna, I forgot the topic on the 24th.
Yeah, we wanted to ask you guys, for those of you who are still online with us, if you want to go ahead and type in the chat box, we gave you just a little glimmer of, taking that breath for yourself today in this last 10 or 15 minutes of today's program. But one of our thoughts for you is we've reserved in our calendars the Friday afternoon, April 24th from 1 to 3 to host another session. Let us know if you'd like us to schedule. One of the thoughts that we're hearing is to do something more in depth on kind of psychological first aid, or an opportunity for you, your staff, your volunteers to log in and be able to process what we've been going through.
Yeah.
Working with Janet and her team, with the CADRE team of emotional and spiritual care and support. Is that a session? We were thinking a Friday afternoon, if at all possible, to maximize people's ability, maybe to shut down a little bit, or take a long lunch break on a Friday and join us. Let us know in the chat box if that's something you think would be worthwhile, something you want to see us invest some time, planning, and effort into. We'd also like to hear from you in these last couple of minutes before you log off. If there are other trainings or web sessions that you have in your mind, questions that you would like to dialogue with your peers about via these new video conference kind of methodologies. We've been hearing questions in our network and our Monday morning conversations about things like disaster documentation. What does that mean? What kind of record keeping do I need to do? What do we need to know about planning for another wave of this pandemic, maybe later in the year? Are there topics, are there things that you're struggling with, things that you're hearing are successes or best practices, an opportunity to support one another? And so we wanted to take a few moments as we close out today's session to ask if you'd like to give us some feedback via the chat. And if not via the chat, you are always welcome to email us at the CADRE Duty Officer or the CADRE Admin account. Any thoughts, requests, ideas you have for ways in which the network can support you and the partnership of working together with one another.
And I will give you a heads up on the when you send an email now, we're creating a form because the email box has just become overwhelming, and we've created a way to sort information by filling out a form. So you don't get the form, well, you'll either get the form by clicking on it, and it will be on the website very soon, right under our email address. Or if you start to type in the email address and send it, it will pop up the form for you. So just before you write a whole novel in an email and send it, know that you're just going to just type a little bit and hit send so that the box pops up for you to fill out the form. And that way we'll be able to sort if it's a question, if it's a request for resources, if it's an issue that you're coming up to. That way it'll make it, we'll be able to respond faster. And I guess, anything else?
Nope, I think that's it, everyone. Stay strong, stay healthy, stay well. We will hopefully see most all of you on Monday morning again in our weekly calls. And, please feel free to add any more information into the chat, thoughts that are still on your mind. But with that, I think we can close it out and have everybody say goodbye. Thank you.